My name is Stephen Pollock. I've been a cardiologist since 1980. I work at the Sandra R. Berman Heart Institute at the University of Maryland St. Joseph Medical Center. I'm going to talk today about the early diagnosis of coronary disease using a test that is simple to get called a coronary artery calcium score. Coronary artery disease, the deposit of stuff in the arteries of the heart, is the #1 cause of death in this country. That has not changed for the past 50 years, despite everything we've done. Coronary disease is the deposit of stuff in the artery. The artery doesn't like it. And when it's there, it puts calcium. And that calcium we can measure. So if you have a coronary calcium score that's above the number 25, then we know you have coronary disease. Now, why is this important? So if I show you these two blockages, a 95% blockage and a 40% block, and I asked you which of these two would cause a heart attack, you would say the 95% block, and you would be wrong. The 95% block impairs blood flow. Therefore, it warns you. You get discomfort when you do things. The 40% blockage does nothing. It does not impact blood flow. We call it coronary regulation. God built it in to protect you. What happens then is this plaque, which is sitting here like that, has a cap on it. And the cap will rupture, and it will create a blood clot. That blood clot then closes off the artery, and you have a cardiac event. That's why you hear about people playing tennis who are fine and then got in trouble. So if we can make the diagnosis of this, we can prevent this, but more importantly, we can prevent that plaque rupture. So this test is the same as getting a colonoscopy. The only difference is you only need to get it once. If it's abnormal, then there's a series of things that we do to make a difference in your life. 4 of them are just lifestyle changes. 1, identify the disease. That means you have to walk around and say, I have coronary disease. You don't worry about it. 2, you don't ignore symptoms. 3, you never gain weight. Notice I didn't say lose weight. I said don't gain it. You have to do an aerobic program. You have to exercise. And the last are drugs. We have 2 drugs that make a difference. The first is aspirin, 81 milligrams of aspirin. What that does, when this ruptures, you get these little things called platelets that lead to a blood clot. The aspirin prevents that from happening. That's why you bruise. The other is a statin like atorvastatin, Crestor, Lipitor. What does that do? Well, first, it prevents this from progressing, which is great because now you won't have an event down the road. But more importantly, it takes that cap and makes it concrete. So it lowers the chance of that cap breaking. And if I can lower that, then you're not going to have an event. This is simple. It's easy. I don't know why it's not done more often. I started doing it 20 years ago. I had it myself. My coronary calcium score at age 50 was 900. That's a big number. There's no correlation between the number and the severity. 900 or 20, you have coronary disease. The treatment is exactly the same. So if you're looking at this, you want to get this test done. If you have an abnormality, any one of the guys in our group, men or women, be happy to see you right away. This should be the same as I know I have to get a colonoscopy. This should be the same as I know I have to get a pap smear. So I got to get it ordered. Tell your primary care, I want a coronary calcium score, and demand it. This test is about prevention. Prevention makes a huge difference in healthcare. It doesn't get all the glitz. Nobody runs up to me 10 years later and hugs me because I identified coronary disease 10 years later. But it makes a huge difference in your life and in the life of everyone in this country and in healthcare costs, et cetera, et cetera. It's the #1 disease. And again, we have all these things that we can do. We can do angioplasty, we can do heart surgery, we can put stents in, we can do ablation. None of those things are available to you if you don't first know you have the disease, and God forbid you have a sudden death. So the one takeaway message from this is you need to pay attention. This is the #1 disease in the country. You need to be proactive to protect yourself from a cardiac event. You do not want to be one of these stories that you hear about. The way to do that is simply get this test. Will it guarantee something bad won't happen to you? No, but it'll lower your chance of having a cardiac event substantially. It is worth the time, it's worth the effort, and it's worth the money.